it's CJ. Are you getting ready to have your baby and thinking about using an epidural? Trust me, you are not alone. Anywhere from 60 to 75% of laboring patients elect to use the epidural. There's a really good reason for that. The epidural is the most effective form of pain management for laboring mamas. Today I'm going to give you some basic information about the epidural, some risks and benefits associated with the procedure. I'll let you know who can have one, who should not have one. And finally, if you stick around, I will tell you what to expect when it comes time to have your epidural placed. So the epidural is a tiny tube that is placed in your back by either an anesthesiologist or a person who's been specially trained in epidural placement. A small amount of medication is going to be infused to that tube. The medication is going to coat your nerves and significantly decrease the pain that you're feeling with those contractions. And by significantly, I mean by 90%. The good news is the epidural lasts the entire time you're in labor. Some of the benefits: you are awake, you are alert, you are part of your birthing process. The epidural medication does not go through the placenta, does not have any effect on the baby. Again, medication in the epidural can decrease your stress hormones. And finally, it is nice to have that anesthesia in place just in case you were to have an emergency C-section. Unfortunately, the epidural is not without risks. One of the major risks is a decrease in your blood pressure. So after you have the epidural placed, you will probably be monitored for a good 20 to 30 minutes just to make sure that doesn't happen. If it does, there's medication we can give you. The epidural also might just affect one side of your body and not the other. If that happens, it's a simple fix. They just adjust the tube so both sides of your body are getting the medication. A small percentage of patients will have severe headaches following epidural placement. Again, that is very easily treated. And finally, most patients will have some tenderness at the injection site. So who can get an epidural? Almost anybody. You do not have to be a certain number of centimeters dilated to get an epidural. You simply need to request it. Ideally, we want for you to be in active labor, and you do need to be able to sit still throughout the entire procedure. Who should not have an epidural? If you have an infection at the injection site. If you have a problem clotting blood, such as if you have a low platelet count, or if you are taking a blood thinner. If you have had surgery on your back, such as a Harrington rod placement, I do recommend you meet with an anesthesiologist sometime in your third trimester. They are going to want to see the operative report, see exactly where the hardware ends. So once you've decided to get your epidural, the anesthesia provider is going to come into your room. They're going to explain the risks and the benefits to you, and they are going to have you sign a consent form. After you've signed the consent, you're either going to sit up on the side of the bed or you're going to lay down on your side, arching your back like a mad cat. They're going to find the site, they're going to clean it off with a soapy solution. After your back is cleaned off, they're going to insert a needle that has a hole in it into your epidural space. The epidural space does not go into your spinal cord. Once they have found the epidural space, they're going to thread the tubing through the needle to the appropriate position. They're going to inject a test dose to make sure that the tube is in the proper place. Once they've confirmed that, they will pull the needle out, leaving the tube in your back. They will tape everything down, and then they're going to lay you down on your back, not flat on your back, but tilted in one direction or the other. And then they're going to start infusing the medication. It does take about 20 to 25 minutes to get full relief. Every contraction is going to get a little bit easier to tolerate once you're laying down. Those patients will fall asleep at this point. It is not because of the medication. It is because you are finally comfortable for the first time in 3 months. The epidural will stay in place through your entire labor. After you deliver, they will shut it all off. And during your recovery period, your nurse will pull the tubing out and put a Band-Aid over the injection site. It does take maybe an hour or two for that medication to wear off, and you will be able to get up and walk after that. So what questions do you have about the epidural? I hope you'll leave those in the comment section below. And while you're in that comment section, I would sure appreciate it if you'd hit the like button, subscribe, share, whatever you feel like doing.
If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.